purpose of today is we're going to do a little mock session between my student and myself, and possibly use it for training purposes. You verbally consent to that?
I do, yes.
Okay, awesome. So what we're going to be working on is your feeling of kind of being always in a rush, always in a hurry, this sort of anxiety that you're experiencing. And what we're looking to do is to try to find some kind of touch tone, some kind of origin that can tie that from where that started.
Yeah, I would love that.
Okay, so tell me a little bit about when was the first time you remember having this feeling? Do you think it was maybe related to school? Was there anything about feeling pressure to perform?
Definitely the pressure to perform is resonating with me.
Okay.
I remember being in school and coming home and showing my dad that I got 100% on a spelling test.
Okay.
And he asked me why only 100? Why did I not get bonus points?
Okay.
So that was kind of the... Since then, I mean, that image is so clear in my head, but since then I feel like there was always this need to not just excel, but like, if there's a word for beyond excel, because 100 wasn't even good enough. And I know he was joking, but I mean, he still does that to this day.
Okay, so when you think about that kind of like hurry anxiety, there's something about that is like I need to produce, I need to be on to the next thing, and that kind of really correlates in my mind. Like I need to get the bonus points. Just being, it's not enough. I need more than that.
Yeah.
Okay.
Yeah.
So you kind of see how that might be.
Yeah.
I mean, there may be more contributing things that I'm sure if we went through your whole childhood, we could pinpoint a whole bunch of things, but for the purpose of EMDR, we need one thing.
Okay.
So I think that might be a good one.
I think so too, because it's so vivid in my mind. And I was really little. I was probably grade 2.
So I'm gonna ask you some really specific questions about the memory.
Okay.
And then once we kind of feel that you've accessed it and you can kind of feel it emotionally, physically, I'm gonna pass these to you.
Okay.
And I'm going to say, okay, Jen, I want you to go with this.
Okay.
Okay, so you're gonna hold them, and we're gonna start off by really focusing on the memory that we talk about, and you're gonna let your mind kind of sit on that, but then you're gonna let it move if it needs to, and I'm gonna check in with you, and we're just gonna see how it goes from there.
Okay.
Sound good?
Yeah.
Okay, so so I want you to think about the memory, and I want you to tell me if I could see that memory in your mind and almost like a snapshot, like a picture, what would I see? Tell me as many details about it as you can.
Can I close my eyes?
Yes, absolutely.
I see an 8.5 by 11 paper with 100% on it in red marker, circled in really big letters, really thick letters. And I feel happy, I feel excited to show my parents. And I honestly don't remember what my mom said. I would imagine it was something, good job. But I remember my dad, and I remember his face. I can kind of feel him so much bigger than me. And I just remember this smile on his face, and I even remember in the moment thinking, I know you're joking, but for some reason this hurts. And that feeling of this hurts, like I know you're joking, but it hurts that, you know, I got perfect on this. And yeah, that's what I see. It's the paper with the red 100.
Okay.
Yeah.
Okay. And are there any other details, Jen, about like where you know that when you're looking around and you're kind of thinking about that memory, anything else that you see or hear or smell that stands out to you?
I can feel certain sensations coming up. Is that okay?
Yeah.
I can feel my eyes feeling a little bit watery. I can feel this slight tightness forming in my chest.
Okay.
My jaw feels a little bit tight.
Okay.
Almost like the upper neck, a little stiff.
Okay. If you had to call this memory, if you had to give it a headline or a caption, what would you call it?
Bonus points.
Okay. And when you think about the memory, the picture, do you have a negative belief about yourself that comes up?
Yeah, that I'm not good enough.
Okay. And so instead of I'm not good enough, when you think of the picture, what would you like to be able to say about yourself now?
That I am good enough.
Okay. When you think about the picture and the cognition, the negative cognition of I'm not good enough, does that feel partially true? Does it feel completely true? And not what you think of yourself now, but just really reflecting on that memory and I'm not good enough. You're gonna gauge how true does that feel to you.
As I think about that test, it feels so conflicting for me because as I look down at the paper, I feel like I am, but then as I hear my dad saying that, I feel like I'm not. And so I would say in that moment, it feels like 6.
Okay, 6 out of 10.
Yeah.
Okay. And just to clarify, so 10 being it feels 100% true, so it feels about a 6 out of 10. Okay.
Yeah.
Okay, so when you think about the memory, Jen, I just want you to really access as many details of it as you can, and I want you to gauge from 0 to 10 how much disturbance do you notice, both physically and emotionally, thinking about that picture.
I'd say about a 6.
Okay. And so we're just going to go back to some of the physical sensations that you were mentioning. So you said that you felt it in your jaw. Anything else that you notice?
No, I can still really feel it in my jaw, almost in my whole mouth. Like the roof of my mouth feels tight.
Okay.
Really my upper body. I feel like from my chest down, I feel fine. From my chest up, I can feel something. It doesn't feel right.
Okay. So you're going to hold the pulsars in either hand. And so what I would like you to do is you're going to really focus on that picture that we talked about. And as you're focusing on the picture, you're going to really notice anything that you feel physically. You're going to notice any emotions. And I want you to just kind of let your mind unfold that. And if you notice yourself kind of drifting off, you're just going to bring yourself back to the memory. I'm going to check in with you, and then we're just going to go from there. Okay. Okay, Jenna, I want you to take a deep breath in. Let it go. Okay, what do you notice is coming up for you now?
I notice that the tightness in my jaw is less. My eyes don't feel as watery. My chest feels a little lighter too.
Okay.
I feel calmer.
Yeah, and are you able to still focus on that picture? Okay, so I want you to just keep focusing on it, and I want you to go with that. Take a deep breath in. Let it go. Okay, Jen, what's coming up for you now?
I can still feel a little something in my jaw. But my chest, that tightness in my chest is gone.
Okay. you're just gonna notice that feeling in your jaw. And I want you to think about if there's maybe something you would like to say. Go with that. Take a deep breath in. Let it go. Okay, what's going on for you now?
It was interesting. I felt myself almost smile halfway through. My brain kind of took me to this place where it wasn't like I was mad at my dad for saying what he did, because I know he was joking. I started getting kind of mad at myself for not speaking up and saying that I am enough and that this is enough, and then I suddenly felt that feeling in my jaw just disappeared. That's kind of when I smiled.
Okay. So you can picture yourself saying that?
Mm-hmm.
Okay.
Yeah.
Okay. So we're just going to do another set just to kind of reinforce that. I want you to just think about that image of you saying that and go with that. Take a deep breath in. And let it go. Okay. What do you notice now, Jen?
I feel really light.
Okay.
I feel like I want to smile. That feeling in my jaw is practically gone.
Okay.
My chest feels light. It feels open.
Okay. I want you to go back to the memory, and you're just gonna let yourself notice whatever is there. And I want you to think about from 0 to 10, reflecting on the memory. Is there any disturbance from 0 to 10? What number would you give it now?
Honestly, I would say 0.
Okay. So you don't notice anything, any physical sensations, any emotional?
No, my chest feels light. I feel like I've kind of sunk into the chair a little more in a good way.
Okay. Do you feel that, thinking about the memory, do you feel that the positive cognition, I am good enough, do you feel like that still fits?
Mm-hmm.
Okay. So when you think about that cognition and the memory, does it feel more true to you now?
Yeah.
And would you say, Jen, does it feel 100% true, or does it feel almost true?
I'd say it feels 100% true.
Okay. Okay. So I want you to just, you're just going to take a minute, and I want you to think back to the memory. And as you do, I'm going to slow down the pulsars, and you're just going to really notice that belief, I'm good enough. I'm going to turn these on, and I want you to just do a bit of a body scan, just noticing anything that you feel, whether it's good, bad, if there's any good feelings. I want you to really try to focus on them and the memory at the same time. Okay, so you're gonna go with that. Okay, take a deep breath in. And let it go. Okay, what do you notice now, Jen?
I just feel calm.
Okay. Great. So that is going to conclude our EMDR session. If we finished, if there was still anything there, like you still felt, yeah, it feels a little bit of a disturbance, then we would end with a containment strategy. We would put whatever is left away, but because you cleared that out to a 0, we don't need to do that.
Amazing.
Okay.